Good afternoon. Thank you all for joining us today. Today is another really strong step forward in our response for COVID here in San Diego County. A number of good news items for San Diego County. We are moving into the orange tier effective tomorrow, which again, when you think about where we've been from regional stay-at-home to purple to red to now moving into orange, you can see the positive direction and trajectory we're on. Because of the presence of the vaccine, and so that should be very encouraging, not just for those businesses that have been impacted, but for all San Diegans who are seeing us work our way out of this pandemic in a positive direction. We also got additional good news from the governor today announcing his Beyond the Blueprint, where we can see a path forward as an entire state for the entire tiered systems being retired as early as June 15th, and I think, again, that will be encouraging. It's been a very long year. But we're in a position in place now where we can really begin to see our way out of that, in large part due to the presence of the vaccine. So quickly today, obviously the official news we got just a short time ago from the California Department of Public Health. Two things that were critical to us advancing to the orange tier. The first was the state hit the 4 million vaccines in that HPI quartile 1, which is what triggered the revisions to the case system in the blueprint. And then the second was our case rate being at 5.8, which is under the threshold needed in order for us to move into the orange tier in that revised framework. And so I'll share with you a slide in a minute for what that means, but it's basically some increased capacity for restaurants, movie theaters, places of worship, museums, aquariums. Our San Diego Padres can move their occupancy to 33% along with other live outdoor events. And so it is, again, continued progress in where we are going. Our case rate was a little bit higher this week than it was last week, and I think that is to be expected. As we loosen restrictions and as people are out more, going into places that are a little bit higher risk, we're likely to see that case rate increase ever so slightly and subtly as we move forward. And I think it's important that we all remember from the very beginning of COVID, our aim and intention has been to avoid overwhelming our healthcare system. That was true last March. That was true this March. It's true today as we head into April. And because we made the decision early and to vaccinate seniors and then move into those with underlying health conditions, the threat or risk of overwhelming the healthcare system is much less. And so a slight uptick in cases is not a cause for alarm in the same way that it was prior to having the vaccine. And so even though our cases crept up a little bit last week to this week, it still kept us under that tier for where we need to be to move into orange. And again, it is likely in the coming weeks it may plateau, stay flat. It could go up, it could go down. But the slight or modest increases, again, are not the same cause for concern that they were. In welcome news, certainly for our restaurant industry, I'm also pleased to share that Dr. Wilma Wooten will be amending the public health order to lift the curfew that has been in place on restaurants and food service establishments, restaurants, bars, wineries, distilleries, and breweries. This has been in effect since July of last year, a 10 p.m. curfew. We will lift that effective tomorrow, allowing those entities to resume their normal operations regardless of hours. They have to follow all of the state guidance around occupancy percentages and indoor versus outdoor and what they can do. But again, I know that will be some relief for San Diego food service and restaurant businesses in San Diego County. The governor today, as has been widely reported, stated that starting June 15th, most sectors listed in the current blueprint guidance can return to pre-pandemic operations, provided that the vaccine supply remains sufficient to meet the need. And so I think that will be a welcome sense of relief. There's going to be more details coming out for the governor's office in the coming weeks about exactly how we will proceed to that June 15th deadline. But on April 15th, vaccines will be open to everyone 16 years and older, and so that would essentially give us 2 months of allowing an access to a vaccine to everyone to get us in a solid position, but I know that will be a welcome relief to everyone. We don't yet have the vaccine allocation numbers for next week. We should get them tomorrow, but we believe we will generally be holding steady, perhaps increasing. We'll have a little bit greater insight into what next week will look like for vaccines in the coming days. But we remain encouraged by the speed at which San Diegans are getting the vaccine. We still need more. We still want more. We still have more capacity to administer them than we are getting. But we feel like we're headed in the right direction. We're confident the supplies will continue to increase as we move forward. And then finally, before I get into the slide on the orange tier and what it means, we just want to reiterate the virus is still active. It is still present in our community. And so we want to encourage San Diegans, please, even though we're headed in the right direction, we're headed in the right direction because of what we've done and the protections we put in place, not in spite of it. And so we still strongly encourage the public, utilize the face covering, avoid high-risk settings, continue to do all of the things we've grown accustomed to doing over the course of the last year. It is not going to last forever, but there is, I think, a testament to the resiliency of San Diego and everything that we've done over the course of the last year. And we want to continue to move forward and be a model and an example and continue to work, again, with that vigilance to recognize COVID is out there. It still has the ability to spread, and so we're encouraged, we're excited about where we're headed, the direction, the trajectory, moving to orange, looking ahead to what's coming at June, the lifting of the curfew on restaurants. But again, let's ensure we continue to do this responsibly and safely. Wear your mask, physically distance, wash your hands, and most importantly, when you have the opportunity and it's your turn, get vaccinated. I'll be eligible for the vaccine on April 15th, and I'm looking forward to looking for an appointment at some point after April 15th when it's my turn. If it's your turn now and you're in the tiers, please go to the website, check your pharmacy, talk to your healthcare folks, see if you can get an appointment to get vaccinated. The more people we get vaccinated, the quicker, the sooner, the less fuel there is for the fire of COVID, and the quicker we can safely work our way out of this. With that, let's pull up our one chart for today, and then we'll hear from Supervisor Vargas. Dr. Wooten and Dr. Shaw are both here as well for questions. These are the primary changes from the red tier. Restaurants can now operate indoors at 50% occupancy, 200-person max. Movie theaters, again, indoors at 50%, 200-person max. Places of worship, indoors at 50%. Zoos, museums, aquariums, indoors at 50%. Gyms can move to 25% indoors, and indoor pools are fine to open. Breweries and wineries can go 25% indoor with a 100-person max. Family entertainment centers, they're indoors at 25%. Bars that do not have meal service can resume activities outdoors. Live events can move outdoors to 33%. That is not just our Padres. That includes live event outdoors, but obviously I know a lot of Padre fans will be excited about that. Amusement parks at 25%, and retail has no capacity limits. In addition to that, the state has put out some guidance around indoor live events and social gatherings that will go into effect on April 15th. So we have about 10 days until that goes into effect, and we'll be posting that guidance. Will be on our website and the state's website. So if you have questions about that and what that looks like between now and April 15th, that information, which is being digested, will be processed and shared with you shortly. With that, I want to turn it over to Supervisor Vargas, and then we will go to your questions.
Thank you, Chair Fletcher. As we move into a less restricted tier due to the lower case rates and more people getting vaccinated, I do want to highlight some of the data that shows how we're doing in respect to vaccine equity. First, a few weeks ago, the governor announced a statewide effort to vaccinate vulnerable populations by providing 40% of California's income supply to identified areas. The state determined 12 health equity zip codes with our county as part of this effort. Our COVID subcommittee identified and submitted 27 additional zip codes that have been the hardest hit by COVID-19, making it a total of 39 health equity zip codes in San Diego County. I'm going to show you a slide now that has specific information related to our health equity zip codes. And if you could look at this, you see that that throughout the county we have identified our vaccination progress in those zip codes, with the dark color green showing the highest vaccination rates in those zip codes. And the total population of these 39 health equity zip codes is 1,081,964, or 32.3% of the total San Diego population. I'm happy to report that these are communities of color that are benefiting from these efforts. For example, in these zip codes, 40% of the Latino population with those zip codes have actually been vaccinated at least once. A lot of this has to do with interventions and the work that we've been doing in the community. The next slide, please, will show you the percentage of population by race and ethnicity. And as you can see, we still have a lot of work to do to reach individuals with certain groups. However, this is why we are identifying and working with churches and trusted community organizations that serve the public, specific populations, to ensure that we're doing everything that we can to make sure that we're reaching every one of our communities, specifically meeting them where they're at. And so the numbers are changing and the interventions are working. We have a lot of work to do, but we're going to continue. Esta semana quiero enfatizar que nuestras comunidades de color se han visto beneficiadas con los esfuerzos del Estado y del condado, al darle prioridad a los códigos postales que han sido más impactados por COVID-19. En el condado de San Diego, 39 códigos postales fueron identificados con una población de más de 1 millón de personas. Hemos visto que el 40% de la comunidad latina ya se ha vacunado con al menos una dosis en estos códigos postales. Y todavía seguimos trabajando para alcanzar otros grupos. Quiero enfatizar también lo que compartió hace unos momentos el supervisor Fletcher, que tenemos un camino claro hacia la recuperación de esta pandemia. Aunque el virus todavía sigue activo en nuestras comunidades y hay variantes, nuestros números de casos han bajado y el total de vacunas administradas sigue aumentando. Hemos recibido noticias del Departamento de Salud Público de California que la tasa de casos en nuestro condado ya es inferior al 5.9 por cada 100,000 habitantes. Y se ha administrado 4 millones de vacunas a personas del cuartil 1 del índice del lugar de salud. Debido a todos estos avances, a partir del miércoles 7 de abril, nuestro condado avanza al nivel naranja. Estas son muy buenas noticias para todos nosotros del condado. Ustedes sigan con las indicaciones del Departamento de Salud Público y seguiremos vacunando. Estas últimas semanas hemos visto la cantidad de vacunas aumentar. Gracias a estos números estamos en una buena posición para avanzar a un nivel menos restrictivo. Ahora que avanzamos al nivel naranja, quiero enseñarles la última información en donde demuestra en dónde están las restricciones. Aquí les muestro varios de los cambios que se esperan. Can you show the slide with the restrictions, please? Los restaurantes podrán operar su interior al 50% de capacidad, las salas de cine al 50%, las iglesias, museos, zoológicos, cervecerías, eventos en vivo al aire libre 33% y parques de atracción. Así que con esta información va a haber cambios empezando el 15 de abril, pero vamos a seguir ayudando a las comunidades que tengan la información que necesitan y hay que seguir usando nuestros protectores para poder estar seguros y sanos. Gracias.
Thank you, Supervisor Vargas. At this point, we'll go to our call-in questions first.
This first call is from Artie Ojeda with NBC7.
Good afternoon, everybody. With the move to the orange tier in some sectors like live event venues, Padre games, and family entertainment centers, capacity limitations increase with proof of testing or vaccinations. Can you comment on the burden that potentially puts on those businesses to verify vaccinations? Because I'm hearing from some people, business owners, that they don't want to be the vaccination police and are concerned about forged vaccination cards. So can you comment on the burden that potentially puts on businesses?
Yeah, Artie, we're still in the early phases of kind of getting that guidance and understanding what that will mean and how it'll work. I know it's been brought up as a possibility, baseball, other large type events, to have sections that where you have to do that. But we don't yet have enough clarity or guidance in terms of how that would actually work, and we really hope in the coming 24 to 48 hours we'll get greater clarity on that. I think the aim and the intention is noble in terms of increasing capacity for people that have either had a vaccine or a recent test to be less. But I do think the point is well taken that it has to be done in a way that eases the burden, again, on those entities that are in charge of that. And so I think, there's a lot of discussions nationwide around this notion of kind of vaccine passports and what it would look like and how it would work. And we're still awaiting additional clarification and guidance for how we would do that.
This next call is from Matt Hoffman with KPBS.
Hi, just looking for a reaction from Dr. Wooten, the public health officer, to the reopening news from the governor. It's at the right time, too soon, too late, just your general thoughts.
Go to Dr. Wooten.
Thank you for that question. I think we've always stated that we are in alignment with the guidance that we get from the state, and our numbers are looking good. So I think it is the appropriate time, but we just cannot let up and throw everything to the wind. We still have to maintain the preventive strategies that were laid out in the press briefing from Chair Fletcher. We have to continue those strategies, but also continue to adhere to the guidance that has been given today with our going into the orange tier. So it's all good news, but we still have to practice these preventive strategies. Thank you.
And then are we still on? I know when we first started vaccinations, you guys had come up with a goal of 70% of residents over 16 vaccinated by July 1. Obviously, June 15th, if we're on that track, that's around when these restrictions are being lifted. What I'm trying to get at is, I mean, when these restrictions are lifted in the summer, will we be close to your guys' goal of herd immunity, do we know? Are we on track to be there?
Well, now the state has increased that from 70 to 75% of the eligible population, 16 years of age and older, be vaccinated. And we shared that information actually in the board meeting earlier this morning. So we've gone up from 70 now to 75% of the eligible population. And we just want to make sure that people continue to get vaccinated, and we'll see where we are in the next several weeks to months.
I'm sorry, just to follow up, can you say, are we on track to hit 75% by July 1?
Well, we are doing well. Again, I can't predict the future. Right now, 50% of individuals that the eligible population have had the first vaccination, and 30% have had are fully vaccinated. So if we continue at this rate, we could be very well on track to make that target. Thank you.
Thank you.
And Matt, just to provide you the specifics on that, Dr. Wooten is 100% spot on. So on our dashboard, what we have on the percentages is the percentages of all people 16 and older who are eligible. So if we said our goal was 75% of San Diegans, right? If it's 75% of those eligible, then right now, as we stand before you on April 6th, 51.3% of that group has already received their first dose. More than 30% has received both doses, or with J&J is fully vaccinated. So when you take into account that right now at April 6th, 51% of that goal, if the goal is to get to 75%, have already received their first dose, then it seems we are well on track to surpass that number by July 1st, if not earlier and if not sooner, particularly as we see an increase in supply. And so I think that's a testament. And when you take into account people that get vaccinated plus people who may have already had it, I think we can get there, provided the trajectory we're on stays. And we don't think we'll stay on the present trajectory. We think as supplies increase, we will be able to move faster through the other half of these individuals we need to have get their first dose.
And this next call is from Brandon Lewis with CBS 8.
Thank you. Thank you, Supervisor Fletcher, for scheduling this to align with the state announcement. The county has the ability to impose some additional restrictions if it feels it's necessary. Do you think that will be the case? And then also, given our case rate increased a little bit this week, is that due to any additional variants? Could you give us an update on that, please?
Yeah, I'll let Dr. Wooten touch on that. But again, Brandon, I think to just reiterate the point, from the beginning, the goal has been to slow the spread of COVID, to make sure we don't overwhelm the healthcare system, the hospital system. The presence of a vaccine and the prioritization of seniors and underlying health conditions, those that are the vast majority of hospitalizations, again, changes that formula and calculus a little bit. And so a slight uptick in cases is not the same cause for alarm today as it might have been a year ago or even six months ago. And so certainly something we're still mindful of. And again, we continue to reiterate, we could not be more clear. We want people to be safe, wear the face covering, physical distance, avoid high-risk settings. We want to continue to come out of this strong. But I think it's important to view the steps we're taking now in the lens of the presence of the vaccine and the much more widespread utilization of the vaccine. But let me let Dr. Wooten talk about her thoughts on any restrictions that would be greater than the state.
Okay, thank you for the question. At this point in time, the restrictions that we had, as was announced this morning or just a few minutes ago by Chair Fletcher, we are lifting that restriction, and we will have the health officer's order signed at the end of the day, being effective tomorrow. And that was the curfew for our restaurants, particularly for the bars. So that's being lifted. At this point in time, although things could certainly change, I don't see imposing any additional or more restrictive measures, putting any more restrictive measures in place. But if things change in the future, we could have additional restrictive measures. But if we continue to decline in terms of case rates and daily case counts, we're very just happy about the direction that things are taking and helping to open up our economy. So again, cannot predict the future, but right now there are no additional restrictions that are in place. Thank you.
Thank you, Dr. Wooten.
Let's go to our final call-in question.
This is from Paul Sisson with the San Diego Union Tribune.
Thanks for taking our calls today. I had a question about the hospitalization rate. If you look on the county's website, it says that 5.5% of the 14,000 people who have been hospitalized during the pandemic.
Paul, it's kind of hard to hear you a little bit. I'm not suggesting you're under the weather. It sounds like you're underwater.
Hello?
Okay, yeah, you want to try again? We're just having a little hard time hearing you.
Yeah, is this better?
A little bit. I'll listen harder.
Okay, I'll speak up.
Okay.
Yeah, I just wondered, for the whole pandemic, the hospitalization rate has been 5.5%. But, as so many people in the high-risk area have been vaccinated, I wonder what that's come down to. What percentage of people who are more recently getting infected are actually getting hospitalized?
Yeah, let me see if Dr. Wooten or Dr. Shaw have the most recent hospitalization rate.
Paul, I don't have the exact answers that you're looking for. We gave the hospitalization overall, cumulatively, it's 5.5%, I believe. I recall saying that in the board meeting today. But if you're looking at just in the last 3 months or so and looking at what that looks like compared to when we were at our peak in November, December, and the first week or so of January, we would have to go back and look at the comparisons. I mean, what we do know is that in the past, I shared what's happening in the past 30 days, in the past 14 days, that there has been a significant decrease. Is not as steep as it was 30 days ago, but we are continuing that path of decreasing hospitalizations and decreasing ICU admissions. Is that, can you refine your question if I didn't answer it?
Oh, no, it's okay. Maybe they get back to me.
Okay.
And I have another question for you, Dr. Wooten. As we stand here over a year from when this thing started, over 1 million people have been vaccinated, and it's only April. What do you make of that? Are you surprised that we got this far this quickly?
Well, the results are a tremendous effort in partnerships across the county. It's not just the county, but our partners. And this is, has been accomplished through the work of all of those that are involved. This was a heroic response. Again, we continue to say, and everyone knows, this is nothing like we've ever experienced before, and hopefully we never will again. So all of the partnerships that have resulted in the results that we see now, but we have to continue. So, and we're not done yet. So I don't want people to give up or think, oh, we have this now that we're in orange tier, we don't have to do any of these things anymore. We want people to continue. If you're not vaccinated, get vaccinated. And once next week when it opens up for 16 years of age and older for individuals to be vaccinated, we want people that are eligible to be vaccinated. And in the next several months, we know that vaccines for 12 to 15-year-old individuals will also be available. So that is something to look forward to as well. Thank you.
Thank you.
All right, I think we have go to our text questions now.
This first text question is from Adam Rakusin with 10 News. Next week, the state will allow indoor concerts, theater performances, and other private gatherings. San Diego County only has 22% of people fully vaccinated. Does that worry you? Is it safe? Why or why not?
Well, again, I think we want to reiterate the same cautions that Dr. Wooten just stated. We're encouraging people to be safe because of the presence of the vaccine, because of the lessened risk. More than 80% of seniors in San Diego County have been vaccinated. And again, that lowers the risk of the healthcare system, but COVID remains out there. So, we think the steps we're taking to move forward, both in San Diego County moving into orange and what the state of California is doing surrounding events and gatherings, we think is appropriate given the presence of the vaccine, and continuing to work through that. But, we continue to urge people, be careful, be cautious, utilize your face coverings, follow the guidance that's out there, and let's see our continued trajectory be in a positive direction as we try and recover from COVID-19.
This next text question is a clarification question from Matt Hoffman with KPBS. He wants to ask, did Dr. Wooten just say next month vaccinations will be available for minors in San Diego?
No, I think what Dr. Wooten said is on April 15th, they'll be available for everyone 16 and older. April 15th, 16 and older. We will see if any guidance changes, and I'll let Dr. Wooten clarify around lowering below 16, but right now, April 15th, 16 and older.
Yeah, what I said, in the next several months, Moderna is going through clinical trials for ages 12 to 15 years of age. So in the late summer, maybe early fall, we should be hearing about vaccinations for that age group. And then there are also trials for 6 months of age to 11 years of age, which will most likely be available next year. So my point is, while right now we have vaccines available for individuals that are 16 years of age and older, clinical trials are currently underway for 12 to 15 years of age, as well as 6 months to 11 years of age. And that's coming in the months and early next year, in the next several months or early next year. So that was my point. Is that clear?
Okay, that was a text question.
That was a text question.
Okay, all right.
Clear to me.
This next question is from Claudia with Univision, and she's requesting a response in Spanish. What should those who haven't been vaccinated keep in mind when engaging in orange tier activities to not put others at risk? What is the county monitoring to make sure case numbers don't rise with reopenings?
Sí, gracias por la pregunta. La pregunta es, ¿qué hacemos para aquellas personas, verdad, que ahora que entramos a esta nueva fase naranja, qué hacemos con las personas que no están completamente vacunadas? Seguimos con los mismos protocolos, hay que ser cautelosos, que sigan las personas usando sus cubrebocas, la distancia, hay que tener mucho cuidado, pues, porque todavía falta una gran cantidad de personas que no se han vacunado. Entonces, eso es número uno. Número dos, el condado va a seguir monitoreando. Sabemos que va a haber un pequeño cambio y que a lo mejor vamos a ver que van a incrementar un poquito a aquellas personas que puedan pues tener el virus, pero lo que queremos recomendarles a las personas es que por favor sigan todas las recomendaciones de la CDC y de nuestro condado para que podamos estar seguros y seguir adelante. Gracias.
This concludes our briefing today. We thought it was important to come to you today, given the changes in our tier and the announcement from the state of California. So we appreciate everyone's flexibility on responding quickly to our press conference today. In the coming days, we no doubt will have additional information, more details, and we will share that with the public and certainly be available to answer any questions. But again, the presence of the vaccine has put us on a good path. The vaccine plus a tremendous amount of hard work, as Dr. Wooten outlined, with all of the healthcare partners, county workers, healthcare system partners, volunteers to get that vaccine quickly administered, along with the great patience of the people of San Diego who for more than a year now have endured a tremendous amount We are seeing a pathway out of this and moving forward, but again, we want to continue to be vigilant to make sure that we have a strong and safe and smooth recovery. So we continue to urge everyone to be careful and be strong, and we thank everyone for joining us today. Thank you.